Let's go over some important points about this study, points that are key to giving an accurate interpretation. Point number 1, we need to determine whether or not there is a blood clot. Here's the first image of the common femoral with the vein open and closed, the junction, the femoral vein, popliteal, small saphenous, and great saphenous all appear to be fully compressible. Now that we are assured that the study is completely negative for deep venous thrombosis, or superficial venous thrombosis for that matter, our next point is to determine whether or not there is reflux. As you can see here, the right common femoral, augmentation, and valsalva appear to be completely normal, as does the augmentation for the saphenofemoral junction, profunda, femoral vein, popliteal, and calf veins. You can see the sonographer actually just does a color Doppler image of the calf veins to prove there's the augmentation and there's no reflux determined or flow determined after release of the calf. Competency is also proven at the anterior lateral branch of the great saphenous and the great saphenous through the thigh. However, having looked through the entire study, you should have noticed that the sonographer performed provocative maneuvers both lying down and standing. Therefore, the images here and the proximal calf, mid, and distal calf, which all appear to be completely normal, are negated by showing the Doppler signal, at least in the calf, with the patient standing, as you can see here. So once the sonographer stands the patient, it invokes a reflux signal. As you see here at mid-calf and distal calf, there's a great deal of reflux occurring in the great saphenous. So knowing that the person likely had varicose veins, mainly in the calf, the sonographer chose to stand the person, and now with provocative maneuvers employed while standing, reflux is identified. You will also want to mention the reflux identified in the small saphenous vein as seen here, as well as mentioning that the reflux appears to only be present at the proximal through mid-calf. However, the distal small saphenous appears competent. Our third point is to mention any perforators that are identified. As you can see here, there's an augmentation with flow going in the correct direction away from the probe. However, upon release, you see the color red moving back toward the superficial tissue, which would be considered reflux. The sonographer mentions a diameter measurement and then moves on to a tributary that is also identified lateral to the shin, and we can see a color augmentation and a release picture showing again reflux. The last point you will want to mention in your impression is that this was a unilateral study and it is proper procedure to just show a compression and flow in the contralateral common femoral. Actually, by the standards of the IAC, we really need to show just the flow, but we tend to also show a compression picture just to make sure and be clear that there was no thrombus identified in the contralateral common femoral and that flow appears normal.